In this video, we shall be looking at motions and mechanics. We shall be looking at the OA, which is the occipital atlantal area. This is the occiput, and that is the atlas. That's what OA stands for. And the AA, which is the atlanto axial area, and the rest of the inferior division, which start from C2 all the way down to C7. So OA, which is considered to be the motion of the occipital condyles on the atlas, which is C1. So let's look at what happens when we have flexion of the cervical spine. Well, the primary motion of the OA is flexion and extension. So this is flexion of the cervical spine. As you can see, 50% of all the motion is happening around this occipital condyles and C1, which is the atlas. Now, that is the OA joint. However, side bending and rotation occurs to the opposite side with either flexion and extension. We're not able to show you the animation of how this actually happens, but it's very critical that you notice that whenever this OA is flexed, side bend left, and it will be rotated to the right. Okay, that will be the opposite side, which means if the occiput on the atlas is actually flexion, side bending will be to the left side and rotation will be to the right side. That's how you make the diagnosis. Okay, so that is a very critical, important thing you need to master for the complex exam. The AA is considered to be C1 motion on C2. As we can see on this animation, this is C1, which is the atlas, and this is C2, which is the axis. Its primary motion is rotation. 50% of the rotation of the cervical spine actually occurs here. Let's take a look at the animation. Rotation to the right, and we can see here that see how most of the motion is around C1 and C2 as the neck actually rotates to the right. Now, that is very important clinically because only rotation occurs at this joint. Therefore, if AA is rotated right, it means that the atlas, which is C1, is also rotated right on the axis, which is C2. Let's take a look at the inferior division, which is C2 to C7, as highlighted in this animation. C2, C3, 4, 5, 6, and 7. It's generally accepted that side bending and rotation often occurs to the same side in the cervical column. Now, on the board exam, it's very important that you know that C2 to C7 are always side bend and rotates toward the same side. However, the inferior division always accounts to 50% of the flexion and extension and 50% of the rotation of the entire cervical spine. Well, let's take a look at how there is rotation component of C2 to C7. As you can see here, that's the rotation component. Now let's take a look at what happens when the patient has flexion and extension of the cervical spine. This is extension and flexion of the cervical spine. As you can see, all the vertebral bodies from C2 all the way down to C7 are able to show you how this good extension and flexion of the cervical spine.